In the only hospital serving a small rural town in Virginia, Nurse Dana Reeves has spent 2 years perfecting the art of invisibility. The chief physician, Dr. Carl Merritt, treats her like background noise, cutting her off mid-sentence, blocking her from critical decisions, reminding the entire staff with casual cruelty that some people simply don't belong in serious rooms. Dana keeps her head down, follows every order, and swallows every humiliation without a word, exactly the way she was trained to. But when a military transport returns from a field exercise with critically wounded soldiers and a war dog that should not be loose tears through the emergency corridor stops dead in the chaos, lifts its nose and walks straight to her, what that animal carries in its teeth is about to unravel 2 years of silence in under 10 seconds. Because there are secrets that no disguise, no matter how disciplined, can hide from someone who truly knows you. When the staff saw what the dog was carrying, the entire hospital went silent. Arrogant doctors froze in shock, and Dana Reeves would never be treated the same way again. If this story already has you hooked, hit that like button right now and let it fly. And drop a comment telling me what state you're listening from. I read every single one. If you're new here, hit subscribe and welcome to Secrets of Silent Badges, where the quietest people in the room always have the most extraordinary stories. Now let's find out what that dog was carrying. The dog's name was Atlas. Dana Reeves did not know that yet. She would learn it in approximately 4 hours, in a way she had spent 2 years trying to prevent. For now, she was carrying a tray of wound care supplies down the main corridor of Mill Haven Regional Medical Center, walking with her shoulders rounded and her eyes on the floor tiles, which was the posture she had practiced until it felt like a second skin. The hospital was small, 32 beds, 1 trauma bay, a staff of 41, counting the night shift custodians, which Dr. Carl Merritt did not, because he did not count people he considered beneath his attention. Dana counted everyone. Old habit. The corridor smelled like antiseptic and burned coffee. Outside the narrow windows, the Blue Ridge foothills were doing what they always did in late October, which was turn colors so aggressively that patients from the cardiac ward sometimes asked to have their chairs moved closer to the glass. Dana had lived in places with no color at all, sand the color of old bone, sky the color of nothing. She found the Virginia hills excessive and beautiful, and completely beside the point. She had been at Mill Haven Regional for 2 years, 1 month, and 11 days. She had chosen it because it was small, because it was rural, because nobody from her previous life would ever have reason to drive through Mill Haven, Virginia, which had 1 diner, 1 gas station, 1 hardware store, and a stoplight that blinked yellow after 9 p.m. She had chosen it because she wanted to disappear. The plan had been working. Reeves. She stopped. Doctor. Carl Merritt was standing at the nursing station with a chart in one hand and a look on his face that he had perfected over 30 years of medicine and approximately as many years of uninterrupted sleep deprivation. He was 54. Lean in the way of men who forgot to eat, rather than men who exercised. His eyes were permanently narrowed, as though the world was printed in a font too small for him to read without effort. The Kowalski chart, he said. I asked for updated vitals at 7. It's 7:18. I updated them at 7:02, Dana said. They're in the system. I don't want them in the system. I want them on my desk. Your desk is in the system, she said. Your preference for paper was removed from the standard protocol in August. He stared at her. It was the kind of stare that had made residents cry. Dana had seen 3 of them cry in her 2 years at Mill Haven. She had handed them tissues and kept walking. What I prefer, Merritt said slowly, as though speaking to someone who required extra processing time, is for my nursing staff to understand that in this facility, I set the standards, not the system, not protocol, me. Is that a difficult concept? No, Dana said. Then why are you still standing here instead of printing the chart? She walked to the printer. Her bright blue scrubs, the standard Mill Haven issue that everyone wore, moved quietly through the corridor. Unremarkable. That was the point. She had learned early in her career, her first career, the one no one here knew about, that certain men required the theater of compliance. They did not want the thing they asked for. They wanted the act of asking to mean something. They wanted the slight adjustment of posture, the drop in eye contact, the small performance of deference that told them the hierarchy was intact and their position within it was secure. Dr. Carl Merritt was that kind of man. Dana was very good at the theater of compliance. She was good at it because she had once been required to perform the opposite at an expert level. And the contrast had given her a precise understanding of exactly how much space a woman could take up in a room before men like Merritt started to feel the pressure of her presence. The trick was to stay just below that line. She printed the chart. She carried it to his desk. She placed it exactly where he preferred it, which was the upper right corner, angled 30 degrees toward the chair, a preference she had observed and catalogued in her first week without him telling her. He did not look up. She walked back to the corridor. Elaine Cho, the day shift charge nurse, fell into step beside her. Elaine was 51, Filipino-American, and had been at Millhaven longer than the East Wing. She had the composure of someone who had outlasted 17 physicians and intended to outlast 17 more. "He's been here since 4, Elaine said quietly. "I know." The Hanover ambulance called in. 3-vehicle accident on Route 11. We're getting 2. I saw the dispatch. "He's going to be impossible. He's always impossible," Dana said. "Today he'll just have a reason." Elaine glanced at her sideways. There was something in that glance that Dana noticed and filed away. A question that Elaine had never asked directly, but that surfaced sometimes in the way she watched Dana work. Dana had been careful. She was always careful. But some people were observant in ways that had nothing to do with training, and Elaine Cho was one of them. "The new resident starts today," Elaine said. "Dr. Farhan. She's from Johns Hopkins." "I know. Merritt's going to eat her alive." "Probably," Dana said. "Hand me the saline bags." Elaine handed them over. Dana began restocking the trauma bay cart with the methodical efficiency that she had learned to perform slightly slower than her natural speed, because her natural speed made people stop and stare, and people stopping and staring was not compatible with invisibility. She had cataloged every piece of equipment in the trauma bay on her first day. She had memorized every expiration date, every supply level, every workflow inefficiency. She had said nothing. She had simply ensured the bay was always stocked, in a way the previous charge nurse attributed to improved vendor relations. It was not vendor relations. It was Dana running numbers in her head at 2 in the morning because old habits were stubborn and sleep was not something her body had ever fully trusted. The radio at the nurse's station crackled. "Millhaven Regional. This is Hanover County EMS. We are 7 minutes out with a priority 1. Male, 43, blunt thoracic trauma from steering wheel impact. GCS 9, BP 80 over 60 and dropping. We have a line in, but he's not holding pressure." Elaine was already moving. Dana was already ahead of her. "Trauma bay." Merritt's voice cut across the corridor from somewhere behind them. "Now, and somebody get Farhan. She needs to see how a real trauma runs." Dana did not look back. She moved to the bay, pulled gloves, positioned the crash cart, checked the airway kit, confirmed the suction line, verified the defibrillator charge, and had the O-negative blood from the mini-fridge at bedside before Elaine came through the door. Elaine looked at the setup. She did that thing with her eyes again. The question. "You've done trauma before," Elaine said. It was not quite a question. "I've done ER rotations," Dana said. Elaine said nothing else. The ambulance bay doors opened at 7:42. The patient's name was Gerald Foss. He was 43 years old and he had hit a concrete divider at 62 miles per hour when the car in front of him stopped without warning. The paramedics had done good work. His airway was intact. He had 2 large-bore IVs running. His pressure was 84 over 58 and trending wrong. Dr. Merritt took one look and started directing with the clipped authority of a man who had genuinely seen worse and genuinely knew what to do in the next 60 seconds. Whatever else he He was not incompetent. Dana knew the difference. She had worked with incompetent under pressure, and it looked nothing like Merritt. Merritt was tired and cruel and dismissive of people he considered beneath him, but his hands were steady and his priorities were correct, and in a trauma bay, that counted. "Pressure's dropping," the paramedic said. 78/50. "Tension pneumo," Dana said, not loudly. Not as a declaration, just the way information surfaces when the evidence is obvious and the clock is moving. Merritt glanced at her sharply. "What did you say?" "Absent breath sounds, left side, distended neck veins, tracheal deviation." She kept her voice even. "Tension pneumothorax." Merritt looked at the patient. He pressed his stethoscope to the chest. His jaw tightened slightly. He picked up the needle without being asked. Second intercostal space, mid-clavicular line. 14-gauge angiocath. The hiss of escaping air was immediate and unmistakable, a sound that Dana had heard in places with no ceiling and no guarantee of morning. And it still carried the same meaning. Pressure released, clock reset, man still alive. Gerald Foss's pressure climbed to 96/64 in under 90 seconds. The room exhaled. Merritt looked at Dana. "Rotations," he said flatly. "Sir? You said ER rotations. Where?" She held his gaze. "Several facilities. Urban trauma, mostly." He waited. She gave him nothing else. The moment stretched. "Fine," he said. "Finish the assessment. Farhan, watch her hands, not her face." Dr. Farhan, who had arrived at some point during the needle decompression and had stood very still in the corner, with the expression of someone recalibrating every assumption she'd made about this hospital in the last hour, nodded. Dana finished the assessment. She did not let her hands move at their natural speed. She let them move at the speed of a competent emergency nurse with good instincts and solid rotations, which was not the same thing as the speed of a woman who had performed needle decompression in the dark, in a moving vehicle, 3 kilometers outside the Pakistani border, while someone fired from a ridgeline above. But it was close enough that Merritt kept watching her. He was still watching when she stepped back from the gurney and stripped her gloves, and that was the first crack in the wall she had spent 2 years building. Gerald Foss was stabilized and en route to Roanoke by 8:45. The second accident victim, a 17-year-old with a fractured radius and a mild concussion, was treated, braced, and discharged by 10. Dr. Merritt disappeared into his office at 10:15. The morning settled back into its ordinary rhythm of routine checkups, a diabetic crisis in room 7, a toddler with a button lodged in his left nostril, and the familiar administrative despair of a rural hospital, perpetually underfunded and perpetually overstretched. Dana went through her tasks with the steadiness she had learned to perform like a frequency, a low, constant hum that kept her below the threshold of notice. She checked Mr. Okafor in room 4, whose wife kept bringing fried plantains despite instructions. She said nothing about the plantains, adjusted his chart, and spoke to him about his grandson's soccer league. She checked Mrs. Platt in room 9, 81 and post-hip replacement, repositioning herself to avoid pressure points no one else had flagged. Dana corrected her quietly. She confirmed Thomas Driscoll's antibiotic schedule. In the break room, she drank half a cup of coffee at the window, rinsed the cup, and returned it to the cabinet, handle facing right. Dr. Farhan found her in the corridor at 11:20. Priya Farhan was 29, small, and carried herself with the careful confidence of someone who had worked very hard to earn a presence in rooms that were not designed to include her. She had graduated top of her class at Hopkins. Dana had looked her up because Dana looked everyone up. Old habit. "Can I ask you something?" Farhan said. "Sure." "This morning, the tension pneumo. How did you catch it that fast?" Dana kept walking. "Experience. You noticed before he touched the stethoscope. You noticed before anyone had done a full assessment. Pattern recognition," Dana said. "Presentation was textbook." Farhan was quiet for 3 steps. "I've been in trauma rotations for 2 years," she said. "I've seen maybe 6 tension pneumos. I've read about them my entire career. I wouldn't have caught it that fast." You would have caught it, Dana said. Probably 8 seconds later. 8 seconds was fine today. Farhan looked at her sideways. You know what 8 seconds means in that presentation, she said. It was not quite an accusation. It was more like a door being held open, an invitation to walk through. Dana did not walk through. I've been a nurse for a long time, she said simply. It adds up. She turned left at the junction, and Farhan did not follow. But Dana heard her stop in the corridor behind her, heard the small pause, the quality of someone standing still and thinking. It was the kind of pause that came before a decision, and Dana had learned to map the sounds of decisions being made the way other people mapped faces. Farhan had decided something. Dana did not know what yet. She filed the uncertainty alongside the question in Elaine's eyes and kept moving. The afternoon was unremarkable in the way rural hospital afternoons often were, a steady low current of need that never quite became crisis but never fully released. Dana moved through it. She answered questions, documented vitals, managed the pharmacy log, covered Elaine's lunch break, and did not think about anything that existed before Millhaven. She had a system. She was Dana Reeves, Charlottesville, nursing school at UVA. Several facilities moving around because she preferred change, which people accepted without probing because nurses moved around all the time. She had come to Millhaven because she wanted quiet. Every element of this was true in the way that partial truths are true. The rest was architecture. She did not think about her first career during the day. She kept the seal intact. At 2:15 p.m., Dr. Merritt appeared at the nursing station and looked at the board. Reeves, sir. The inventory request for the trauma bay. I've been asking for an updated list for 3 weeks. It's been updated. System shows current as of this morning. I need a printed list for the insurance review. I can print it now. Why wasn't it printed already? Dana looked at him. She gave him a half-second of the blankest possible expression. Because the request specified digital submission. The insurance portal doesn't accept paper. The portal is down. I can print it, she said again. He stared at her in the way he had stared at her that morning, with the particular quality of a man whose instrument was reading something he could not identify. Where exactly did you train? He said. I've covered that. You covered it with the phrase several facilities, which tells me nothing. It tells you what you need to know, she said evenly. My credentials are on file. I passed your competency review. Is there something specific you'd like me to provide? His jaw moved. He was not a man who was used to being answered this way. He was used to staff who deflected with apology, who softened the edges of pushback until it ceased to be pushback at all. Dana had reached a line and she knew it. She stepped back from it. I'll print the inventory list, she said, and walked to the printer. He watched her go. She felt it without turning around. At 3:41 p.m., the call came in. It came first through the sheriff's department frequency, which the front desk monitored on a secondary radio that most of the staff had stopped paying attention to because it was usually traffic reports and noise complaints. Dana heard it. Her body heard it before her mind processed the words, which was a response so deeply trained that no amount of civilian routine had ever fully suppressed it. Something changed in the quality of her attention. Something sharpened and went cold and very still, in the place behind the sternum where operational awareness lived. All units. Fort Pickett training accident, Route 40 near the county line, military convoy vehicle rollover, confirmed 3 injured, possible 4, EMS en route, requesting nearest medical facility alert. Fort Pickett was 40 minutes away under normal conditions. The county line was 22. They were the nearest medical facility. Elaine, Dana said, her voice carrying the quality of calm that means the opposite of calm in a useful way. Elaine was already at the radio. I heard it, Elaine said. Dr. Merritt came out of his office. What's the call? Military training accident. Route 40, we're the closest. He looked at the board. They had 6 patients currently admitted. The trauma bay was clear. They had 1 surgeon on call, Dr. Westfall, who was good but slow to arrive. They had 1 unit of O-negative left from the morning and a blood bank response time of 40 minutes. How many coming? 3 confirmed. Possible 4. He did the math. Dana watched him do it. It was the same math she had already run 2 minutes ago, before anyone else in the building had processed the dispatch frequency. She had already ranked the injuries by likely severity based on mechanism: rollover, military convoy, Route 40, which was a 2-lane state road with a posted speed of 55 and a real-world average of 68. Call Westphal, he said. Get the bay prepped for multiple. Call Roanoke and tell them we may need to transfer depending on severity. Already done, Dana said. He looked at her. She held his gaze. The blood bank call, he said. Also done. They're starting the pack process. 35 minutes. A muscle worked in his jaw. Fine, he said. Get the bay ready. She was already moving. The trauma bay had been prepped that morning after the Foss case. Dana ran through it again with the focused attention that military personnel apply to equipment before an operation. Not the checking of someone who fears being wrong, but the checking of someone who knows that right now, at this moment, this is the only thing that matters, and therefore it receives the entirety of available focus. She ran the check in 4 minutes and 12 seconds. She knew, because she always knew. Farhan appeared at the door. Can I help? Dana looked at her, assessed, decided. Blood pressure cuffs, all 4 stations. Check the seals on the suction lines. If there are blast injuries, we may get soft tissue damage, so pull the wound irrigation equipment and put it where I can reach it fast. Farhan moved without asking why. Dana noted that. Filed it away. A person who moved without asking why, in a moment of controlled urgency, was a person worth knowing. Dana finished the cart setup and stood for 1 moment at the window of the trauma bay, looking out at the ambulance bay, which was empty and would not be for long. She thought about the convoy. Fort Pickett ran infantry and armor training. Route 40 near the county line had a long straightaway ending in a sharp curve that people misjudged. A rollover at speed in a military vehicle meant secondary impacts, thrown cargo, blunt force injuries, high, extremity fractures, high, head trauma, moderate, junctional hemorrhage, possible. She had supplies for all of it. She breathed. This was the moment, in her experience, when the body made a choice, not a conscious choice. A deeper one. In the architecture of the nervous system, in the places where training and memory and identity lived below the level of thought. The body decided whether this was a situation or a mission, whether she was Dana Reeves, rural ER nurse, or something else entirely. She breathed, she told her body. This is a situation. She was not sure her body believed her. She was not sure it mattered. She heard the sirens first, while they were still at least 2 miles out, which was another thing she did not explain to anyone. She was already at the bay doors when they opened. They came in fast. The first vehicle was a county EMS rig with a soldier in the back who was conscious and angry about it, which was a good sign. Specialist Marcus Webb, 26, left shoulder dislocation and a scalp lack that had bled dramatically and was still bleeding enough to look worse than it was. He was gripping the side rail with his good hand and speaking, which meant his airway was intact and his mental status was functional. The second vehicle was 20 seconds behind. Staff Sergeant Kevin Ortega, 31, blunt abdominal trauma. Guarding his right side the way people guard their right side when something in the right upper quadrant is producing more pain than the brain wants to deal with, which meant liver or spleen, and given the mechanism, rollover, seatbelt catch, high-speed deceleration, the probability weighting was clear. His pressure was 91/62, pulse 114, skin pale and slightly clammy. The paramedic briefing him was using the language of someone who had been trained to give concise reports and was genuinely alarmed beneath the concision. BP's been trending down for the last 8 minutes. We pushed a liter of saline, got about 90 seconds of improvement. He's guarding hard right upper quadrant, percussion dullness. Hepatic hemorrhage, Dana said quietly. Not to anyone in particular. to the room. Merritt was there. He heard it. He did not contradict her. "Get Westphal on the phone," he said. "Tell him this is not a come-when-you-can call." "Already done," Elaine said. The third soldier came in on a backboard. Private First Class Deshaun Carter, 19. He had been in the back of the vehicle when it rolled and had taken the worst of the structural forces. Left femur fracture, right radius fracture. A contusion pattern across his chest that was consistent with secondary impact against interior equipment. He was conscious, afraid, and very young. Dana moved to him first. Not because his injuries were the most critical, Ortega was, but Carter's fear was a clinical variable. 19-year-old patients in pain who are also afraid have neurological responses that complicate assessment and can mask developing conditions. She took his hand. Not gently, with the measured pressure that communicates presence without sentimentality. "Deshaun," she said. He looked at her. "I've got you. You're at Millhaven Regional. Your injuries are real, and they hurt, and we're going to deal with them. Are you with me?" He swallowed. "Yeah." "Good. Tell me where it hurts the most." "My leg. And my chest." On a scale of 1 to 10, the chest pain. 7, maybe 8. "Does it change when you breathe deep?" "Yes." She ran her hands along his ribcage, methodical, reading with her fingertips. 3 ribs, probably 4, with the fracture pattern consistent with impact rather than crush. She palpated his abdomen. His reaction was limited to the upper quadrant on the right, which was different from Ortega's pattern, but she filed it and kept moving. "You're doing well," she said. "I need you to stay still for me." "My guys," he said. "Ortega and Webb. Where are they?" "Being treated. Both of them are talking and breathing." He exhaled. She got his vitals, ran the secondary assessment, flagged the rib concern for chest imaging, and moved back toward Ortega's bay. What was happening there was organized but strained. Ortega's pressure was 87/58. Merritt had a fast exam running, focused abdominal sonography for trauma, and the image on the screen was showing what the physical exam had already suggested. Free fluid in Morrison's pouch. The liver was bleeding. "He needs the OR," Merritt said. "Where the devil is Westphal?" 12 minutes out, Elaine said. 12 minutes. Dana ran the calculation without being asked. Ortega's pressure was dropping at approximately 2 to 3 millimeters per systolic per minute, given the trend over the last 20. 12 minutes put him at 62 to 65 systolic, which was a number with consequences. "Resuscitative strategy," she said, moving to the blood warmer. "Permissive hypotension, limit the crystalloid. Tranexamic acid now if it's in the window." Merritt turned. The look he gave her was not the look he had been giving her all day. It was different, more complex. Time of injury was 43 minutes ago, the paramedic supplied, because the paramedic was a professional and knew why the question mattered. 43 minutes. TXA window was 3 hours from injury. Clear. "Give the TXA," Merritt said. He was looking at Dana when he said it, not at the nurse who was standing at the medication cabinet. He was looking at Dana in the way a person looks at a tool they have suddenly realized is different from what was labeled. She did not look away. She moved to the blood products and began the push, the sequence standard in military trauma hospitals since 2010, and that civilian hospitals had taken another 4 years to widely adopt. Balanced resuscitation, 1-to-1-to-1 ratio, plasma and platelets alongside packed red cells, because the coagulation cascade matters as much as the volume. "That's a military transfusion protocol," Farhan said quietly from behind her. "It's evidence-based," Dana said. "It's also what we have." "Where did you learn it?" "Training," Dana said. She pushed the blood product. Ortega's pressure steadied at 89/61. Not great. Not lost. Westphal arrived in 11 minutes and 40 seconds. Faster than predicted because he had understood the urgency. He reviewed the fast, reviewed the labs, reviewed the trend, and made the right call. Or now. Ortega went up. Dana stepped back. The trauma bay had a particular quality after a patient left for the OR. The suspended quality of a space that had been fully inhabited by crisis and now held only the debris. Gloves on the floor, discarded packaging, the faint copper note in the air. She was beginning the reset when she heard it. Not with her ears first, with something older. A change in the quality of the ambient sound in the corridor outside. A shift in the way sound moved when a large, fast-moving body enters a space not built for it. Then she heard the nails on the floor. She had heard that sound in compounds and forward bases and places without names. The rhythm of a working dog at a run, her hands stilled. She did not move toward the door. But her body was already turning, because the smell that came in under it was not antiseptic and coffee and the copper of blood. It was desert and nylon, and the chemical note of a working dog's coat after a training run. The door hit the wall with a bang. Atlas came in at a run. 78 pounds of Belgian Malinois in a tactical vest with a handler somewhere behind him that he had outpaced by a significant margin. And he crossed the trauma bay in 4 strides and stopped directly in front of Dana Reeves. He sat. His eyes did not leave her face. In his mouth, held with the careful precision of a dog trained to retrieve rather than destroy, was a black nylon armband. The kind worn on the upper arm during training operations. Standard issue in teams that used them for field identification. Worn on the inside of the arm, where civilian eyes would not catch them. This one had a call sign stamped on it. Ghost Actual. Dana had not heard that name in 2 years, 1 month, and 11 days. She had not planned on hearing it again. The handler arrived in the doorway. Corporal Jenkins, young, wide-eyed, breathing hard. "I am so sorry. I don't know how he got off lead. He just bolted when we came through the bay doors." He stopped. He was looking at his dog. Atlas was looking at Dana. Atlas had not moved. Corporal Jenkins had been working with Atlas for 8 months. He had seen Atlas retrieve objects, secure suspects, locate IEDs, perform room entries. He had never seen Atlas sit voluntarily in front of a stranger and refuse to move. Working dogs do not do that. They do not sit. They do not wait. Unless they have found what they were looking for. Corporal Jenkins looked at the armband in Atlas's mouth. He looked at the name stamped on the inside. He hadn't noticed it before, too busy chasing 78 pounds of Belgian Malinois through a hospital. He looked at the nurse standing in front of his dog. She was not moving. Her hands were at her sides. Her face had done something that Jenkins could not fully describe. A change in the quality of her stillness. From the stillness of a person who is being still, to the stillness of a person who has become something else entirely. The shoulders had changed. The line of the jaw. The way her eyes were looking at the dog, which was not the way people looked at animals. It was the way people looked at something they had lost. From the doorway, Dr. Merritt said, "What in the world is that animal doing in my trauma bay?" No one answered him. Jenkins said quietly, "Ma'am, that armband. Do you know, is that—" Dana reached down. Atlas did not move away. He lifted his jaw slightly, offered the armband the way a working dog offers a retrieve to its primary, not to a handler, to the one who owns the mission. Her fingers closed around the nylon. She straightened. She held the armband in her hand, and she looked at it for 1 moment, which was not a long moment but contained the weight of 2 years and several lifetimes. Then she looked up. Elaine was in the doorway. Farhan was beside her. Jenkins was holding the doorframe. Merritt was behind all of them. The armband said, "Ghost Actual." Atlas was still sitting. He had not been sent to retrieve this object. He had been transported in the convoy vehicle that rolled on Route 40. He had survived uninjured. He had been with Specialist Webb, whose kit scattered on impact. He had retrieved the armband the way he was trained to retrieve objects of importance. He had smelled the corridor. He had bolted. He had come directly here. Dana looked at the dog. The dog looked at Dana. In the doorway, Dr. Merritt said, "Reeves, explain, now." She looked at him. 2 years of silence in that look. 2 years of wound care trays and printed charts and the theater of compliance and the careful, disciplined performance of a woman who was not what she was. She held the armband. She did not explain. Not yet. "The dog found me," she said quietly, and left it there. The silence lasted 4 seconds. Dana knew because she counted them. Merritt's expression moving from demand to something he could not name. Elaine's eyes going from Dana to the armband and back. Farhan very still in the doorway, not frozen, but processing at a speed that most people did not recognize as thinking. Atlas shifting his weight and placing one paw lightly on Dana's foot. Not aggressive. The way a dog says, "I know where you are. I am not leaving." "Reeves," Merritt said again. Dana looked at him. She had practiced this moment, in the abstract, not because she expected it, but because she prepared for things she did not expect. She had a version of this conversation rehearsed. A deflection, a partial explanation, a plausible account that would satisfy a civilian inquiry without opening the things she had sealed. She looked at the armband in her hand. She looked at Atlas on her foot. The rehearsed version dissolved. "Get the dog some water," she said to Jenkins. "He's been in a rollover." Jenkins blinked, looked at his dog, looked at her. "Ma'am, he's dehydrated and he ran. Water first." She kept her voice even. "Then I'll explain." Jenkins moved. He was young and he had been trained to respond to command presence. And whatever Dana Reeves was doing with her voice in that moment, it was command presence. He went to the supply sink, found a clean bowl, filled it, and set it in front of Atlas. Atlas did not move from Dana's foot. "He'll drink when he's ready," she said. "He's not leaving until I tell him to." Merritt stepped forward. He stopped 3 feet from her. Up close, he had the look of a man whose understanding of a situation has just been fundamentally revised and who is not yet certain what to do with the revision. "That armband," he said. "Ghost actual. That's a call sign." "Yes." "Military." "Yes." "Whose?" She looked at him. "Mine," she said. The word landed in the room with a weight she had spent 2 years preventing. Elaine exhaled slowly. It was not a sound of surprise. It was the sound of a woman whose instrument had been reading something for 2 years and had just been given the calibration key. Farhan said nothing. Merritt looked at the armband, at the dog, at Dana, who was standing differently than she had been standing an hour ago. Not dramatically differently. Not with the performed transformation of a movie reveal. Just correctly. The way a person stands when they stop correcting their posture. "You were in a SEAL team," he said. It came out like a statement but was a question. "I was a Navy SEAL commander," Dana said. 05. Echo Squadron, DevGru. I left active duty 2 years ago. The silence this time was different. It was the silence of a room recalibrating. Merritt looked at her. "DevGru," he said. "Yes. That's Naval Special Warfare Development Group." "It is." He looked at the dog. "And the dog? Atlas worked with my team for 4 years. He was assigned to our unit. When I left, he was reassigned." She looked down at the dog. "I did not know he was at picket." "He found you," Merritt said. "He smelled you in the corridor and found you." "Yes." He turned away, turned back, ran one hand across the back of his neck, a gesture Dana had observed in men encountering information that required significant reorganization. "The tension pneumo this morning," he said. "I've performed needle decompression in the field, multiple times. The TXA, the Balanced Transfusion Protocol. Standard in combat trauma since 2010. The blood bank call, the Roanoke call, the pressure math on Ortega. Tactical triage. You assess resources, severity, and logistics simultaneously. It becomes automatic." Merritt looked at her. "How long here?" 2 years. "And before that?" 14 years active duty, 6 deployments, Afghanistan, twice, Iraq, Syria. 2 locations I won't name. The hallway outside had acquired people. 3 orderlies who had heard something without knowing what. Specialist Webb on a gurney in the corridor, and 1 other person standing in the corridor with the stillness of someone who had spent a career being still in dangerous places. He was 6 feet 2, 40 years old, approximately. The build of a man who had been carrying weight for a long time. He wore a Fort Pickett training uniform, insignia removed for the exercise. He had a cut above his right eye addressed with field tape. He was looking at Dana through the doorway. Dana saw him. Something happened in her face. Elaine would later describe it as watching a wall become a window. "Reeves," the man said. His voice was low, specific. The voice of a man who had operated in silence for enough years that he had learned to carry more meaning in less volume. "Commander?" Dana said. Merritt turned. Commander Vincent Hale, training advisor at Fort Pickett, stepped through the trauma bay door and stopped in front of Dana Reeves and looked at her the way people look at things they believed they had lost. Atlas stood up. He had been sitting for 11 minutes. He stood, turned, looked at Hale, looked at Dana, and made the low sound that working dogs make when they have completed a task that mattered. "He found you," Hale said. "He found me," Dana said. Hale looked at the armband in her hand. His jaw moved. "That was in Webb's kit," he said. "I know. Atlas pulled it from the wreckage." "I know." He was quiet for 2 seconds. "You've been here." 2 years. "Yes." He looked around the trauma bay, at the fast equipment, at the blood warmer, at the cart she had staged. Any trauma professional would recognize it as the staging of someone who had managed mass casualties before. "Ortega," he said. "Surgery, hepatic hemorrhage. He's going to make it." Hale closed his eyes, opened them. "Carter. 3 or 4 fractured ribs, femur, radius, stable. Webb. Shoulder dislocation, scalp lacy, reduced and cleaned. He's complaining." Something crossed Hale's face that was not quite a smile but was close. "Of course he is," he said. Behind him, Merritt stepped forward. "Commander Hale." Hale turned. "Doctor, this woman has been working in my hospital 2 years under credentials I now understand may be incomplete. Her nursing credentials are legitimate. She obtained them after separation. She is also a Navy SEAL commander with 14 years of special operations medicine. Yes. Working as a floor nurse. Yes." Merritt looked at Dana. "Why?" he said. Dana held the armband. She looked at Hale, at Atlas. At the bay she had stocked and restocked for 2 years, equipment she had memorized, patients treated at a fraction of her actual capacity, because using the rest would have meant being seen. "Because I needed quiet," she said. The same answer she had given 2 months ago when he asked why she came to Millhaven. Still true. Still incomplete. The complete version, a mission, had gone wrong. 3 members of her team had not come home. An 8-second gap between her order and the detonation. Whether those seconds mattered, she had never determined. She had stopped trying, because the trying made it impossible to function. She had come to Millhaven to be a person who did small things, to confirm antibiotic schedules, to stay below the line. She looked at the armband. Ghost actual. Atlas pressed his head against her leg. In the corridor, Specialist Webb's voice carried through the open bay door. "Is that Atlas? Is that our dog? What is Atlas doing in the hospital?" No one answered him. "Reeves," Merritt said. She looked at him. He was not looking at her with the expression she had expected, the expression of a man whose authority has been challenged, whose institutional order has been revealed as insufficient. He was looking at her with the expression of a physician who has just realized that the person in front of him has been treating patients at 10% capacity for 2 years while carrying something that weighed considerably more. "You saved Ortega," he said. The TXA. The transfusion protocol. The pressure calculation. He paused. FOSS this morning before that. The pneumo. Those were straightforward, Dana said. They were not straightforward, Merritt said. They were fast. They were correct. And they happened because you were here. He looked at her for a long moment. How many others? In 2 years. How many times have you caught something early enough to change the outcome and said nothing? Dana was quiet. The number was not small. Atlas made the small sound again and pressed harder against her leg. She looked at Hale. He looked back at her with the expression of a man who had been waiting, patiently and without pressure, for 2 years. I owe you an explanation, she said. You owe me nothing, he said, but I'd take one. The trauma bay had been reset by nobody while all of this was happening. Dana had been restocking it herself, automatically, while she talked. Gloves removed, packaging collected, cart restocked. Her hands had a separate operational protocol from her voice and had not yet received the signal to stop. She looked at her hands. They were not shaking. They had not shaken in 14 years. They had not shaken in this bay today, even when Atlas had found her. She put the armband on the counter beside the suction line. She looked at Merritt, then at Hale. One at a time, she said, and not here. She looked at the door, at Webb in the corridor, at the orderlies who had drifted away, at the hospital around her, which was small and rural and underfunded, and full of people who needed things done correctly. Ortega first, she said. I need to be there when Westphal comes out. Merritt looked at her. For the first time in 2 years, 1 month and 11 days, he did not look at her the way he had been looking at her. Yes, he said. All right. Atlas followed her out of the bay. Jenkins watched his dog walk away with the nurse and looked at Commander Hale and said, with the exhaustion of a man who had been chasing a Belgian Malinois through a hospital. Sir, what just happened? Hale looked at the armband on the counter. A dog did his job, he said. Westphal came out of the OR at 6:47 p.m. He was still in his surgical cap. He pulled it off in the corridor the way surgeons do when the outcome is good and they want to mark the transition. Dana watched him do it from the chairs outside the OR suite, where she had been sitting with Atlas's head on her knee for 40 minutes. He's stable, Westphal said. Bleeding controlled. He'll need monitoring for the next 24 hours, but the hepatic repair held. Good organ. He's young. Thank you, Dana said. Westphal looked at her, at the dog, at the armband she was holding. He had heard by now some version of what had happened. Millhaven was a small hospital. Information moved through it the way water moved through old pipes. Not always cleanly, not always direct, but it got there. Elaine told me something, he said. She tells people things, Dana said. She said you called the hepatic hemorrhage before we had imaging. It was a reasonable call based on mechanism and presentation. Westphal looked at her for a moment. It was the right call. 40 minutes earlier, we would have been working against a worse picture. He paused. I'm glad you're here, Reeves. Whatever the circumstances. He walked away. Dana sat with the dog and the armband and the information that Ortega was going to live, and she processed it the way she had processed outcomes in the field. Not with relief exactly, but with a settling of the system, a recalibration from active management to post-event assessment. She had made the right calls. She had made them because she knew how to make them. She had been making them, quietly and without acknowledgement, for 2 years, and Ortega's stable pressure in a recovery room 60 feet away was the clearest possible evidence of what that had cost and what it had been worth. Atlas lifted his head from her knee. He looked at the corridor. Hale came around the corner. He had cleaned the cut above his eye. His training uniform was dust-marked from the exercise, the collar carrying the worn quality of gear that had been through something. He sat down in the chair beside Dana without asking permission. They sat in silence for a moment. which was the kind of silence, the kind that exists between people who have been in enough genuinely silent places together that silence between them carries no pressure. "Jenkins is beside himself," Hale said. "Atlas is fine." "I know. Jenkins is also fine. He's just never seen a dog do that." "Atlas was always unusual," Dana said. "He was always yours," Hale said. "Even after reassignment. He never transferred the primary bond. The handlers after you, he worked with them, but he worked for you. Even when you weren't there." Dana looked at the dog. Atlas looked back at her with the uncomplicated attention of an animal that had found what it was looking for and considered the question settled. "I should have called," she said. "Yes. I didn't know how to call without explaining." "Yes," Hale said again. The same word, a different weight. "I didn't want to explain. I needed to not be that person for a while." He was quiet. "The 8 seconds," he said finally. She did not respond. "You know what the after-action said," he said. "I know what it said. It said the detonation was outside the window regardless of order timing. The structural failure was preset. Your 8 seconds did not change the outcome." "I know what it said." "You don't believe it." She turned the armband over in her hands. The nylon was worn at the edges. Atlas had carried it carefully, but it had been through a rollover in a military vehicle, and the evidence was in the fraying and the dust embedded in the stitching. She had looked at it for 40 minutes and thought about the difference between a report that was accurate and a report that resolved anything. Those were not the same document. "I believe the report was accurate," she said. "I don't know how to make that stop mattering." Hale looked at his hands, then at the door to the OR suite. "3 people were saved today," he said. "By you, specifically by you. Ortega's alive because you knew the protocol and you knew the timing and you called it before anyone else in that room had formulated the question. That's not the same thing." "No," he said. "It's not. Nothing is the same thing. That's not what I'm saying." He turned to look at her directly, and his expression was the expression of a man who had thought carefully about what he was going to say and had decided to say it plainly. "I'm saying that you have been carrying the 8 seconds like it was the entire mission, and it wasn't. And the people in this building who are alive right now because of what you know and what you've been doing quietly for 2 years, they are not a substitute for what happened, but they are real, and you are real. And this place found a way to need you the way the other places needed you." He paused. "You've been ghost actual the entire time. You just stopped letting anyone see the call sign." Dana was quiet for a long time. Outside, the Virginia hills were doing what they always did at dusk in October, turning the sky above the Blue Ridge that shade of purple-orange that she had observed from the break room window for 2 years without allowing herself to fully register it, because registering it felt like admitting she was staying. She was staying. She had been staying longer than she had admitted to herself. The armband in her hand said Ghost Actual, which was the call sign of a person who led from the front, who moved first, who made the call and lived with the outcome. She had been trying to put that person down for 2 years. She had discovered over the course of one afternoon and one Belgian Malinois with an operational agenda that the person would not stay down. That was not the same as resolution. It was not even close to resolution, but it was something she could work with. "Merritt wants to talk to you," she said. "I know. He's going to ask about a formal arrangement, some kind of role that uses what I actually know." "I imagine so. What do I do with that?" Hale was quiet for a moment. Then, "What do you want to do with it?" Dana looked at the dog, at the OR door, at the corridor of Millhaven Regional Medical Center, which was small and rural and underfunded and full of people who needed things done correctly. She thought about Carter, 19 years old and afraid on a backboard. She had held his hand in the way that communicated presence without sentimentality, and he had exhaled, and that had been something. Not everything, but something. She thought about Ortega's pressure stabilizing, about Gerald Foss that morning, the hiss of escaping air, the pressure climbing. About Mrs. Platt repositioning herself in a bed, pressure points nobody else had caught. About the inventory she restocked in the dark hours, and the calls she made before anyone else had processed the frequency and the number, which was not a small number, of times she had seen something that needed catching and caught it and said nothing. She thought about 2 years of operating at a fraction of available capacity, and what that fraction had still managed to produce. "I want to stop working at 10%, she said. Hale said nothing. "I want to be useful," she said. "I want to be here. I don't want to keep pretending the knowledge doesn't exist." "That's not the same as going back," he said. "No," she said. "I know." She stood. Atlas stood with her immediately, the way he always had, anticipating before the movement was complete, already oriented in the direction she was going to move. He had done that in compounds and forward bases and places without names, and now he did it in a hallway outside an OR suite in rural Virginia, and the continuity of it hit her somewhere below the level of thought. Some things did not change. Some things were not supposed to change. She clipped his lead herself, because Jenkins had left it on the chair and departed at some point during the last hour. The quiet tact of a young soldier who understood that some conversations required privacy. She looked at Hale. "The 8 seconds, she said. "Yes?" "I'm going to need more time with it." "I know," he said. "You'll have it." She walked toward Merritt's office with the dog beside her and the armband in her hand, and the 14 years of everything she had been carrying in the place where it had always lived. Not gone, not resolved, but present in a way she was no longer spending every available unit of effort concealing. It was still heavy. It would be heavy for a long time. But Ghost Actual had never been the call sign of someone who put things down because they were heavy. The hospital was quiet at this hour. The shift had changed. Elaine was at the desk, and she looked up when Dana came down the corridor with Atlas beside her. And something passed between them that was not quite a conversation, but contained more than most conversations. "How is he?" Elaine said. "Stable. Westphal says the repair held." Elaine nodded. She looked at the armband, then at Dana, then at the dog, then back at Dana with the expression of a woman who had been at Millhaven long enough to outlast 17 physicians and who understood, without requiring explanation, that the 17th was not going to be the last. "Ghost Actual," she said, reading it. "Yes." "That's you." "It was," Dana said. Then after a moment, "It is." Elaine looked at her for a long moment with the expression of a woman receiving a clarification she had been waiting 2 years to receive. "I'll update the chart," she said. Dana kept walking. Merritt's office light was on. She knocked. "Come in," he said. She went in. Merritt's office was small. He had a desk, 2 chairs, a window that faced the parking lot, and a framed license on the wall that Dana had read once and never looked at again. He was sitting behind the desk when she came in. He looked at the dog. He looked at the armband. He did not tell her to take a seat. She sat anyway because they were past the theater now. Atlas lay down at her feet with the settled finality of an animal that had completed its objective and was prepared to remain indefinitely. "Westphal says Ortega is stable," Merritt said. "I know." "He also said you called the hemorrhage before imaging." "I did." He was quiet for a moment. Outside, the parking lot lights had come on. The last of the October sky was doing the thing with the colors above the roofline. "I want to ask you something," Merritt said, "and I want a straight answer." "All right. In 2 years, how many times have you let a situation go further than it needed to because you were managing what you knew?" Dana looked at him. She thought about the honest answer. She had prepared for many versions of this conversation over 2 years, and none of them had included a man like Merritt asking the precise question that mattered most. "Enough times," she said. His jaw tightened, not in anger. In the way of a man receiving information that confirms a suspicion he would have preferred to be wrong about. "Carter," he said. His rib fracture pattern. You flagged it for imaging. Yes. You saw something else, in the palpation. What did you see? She looked at him steadily. Subtle, paradoxical movement on the lower left. It was minor, within normal variation for the mechanism. I flagged it because the threshold for imaging in pediatric and young adult blast-adjacent presentations should be lower than our current protocol. Merritt was very still. Paradoxical chest wall movement in a 19-year-old with blunt thoracic trauma, he said. It was subtle. It is also the early presentation of a developing flail segment. Yes. He stood up. He was already reaching for the phone on his desk. How long ago did you palpate? He said. About 2.5 hours ago, she said. He dialed. She heard him speak to the night nurse in Carter's room. Heard the instructions for an immediate repeat assessment and repeat imaging. He was already moving toward the door when he put the phone down. Come, he said. She came. Atlas came with her. They moved through the corridor the way the hospital moved at this hour. That quality of a place between shifts, between crises. The low hum of monitoring equipment and the careful footsteps of people who had learned to be quiet without being asked. Dana matched Merritt's pace, which was fast, not a run. The practiced speed of a physician who had learned that running created panic and panic created errors. Carter's room was at the end of the south corridor. He was awake. His mother was in the chair beside him, a woman who had driven 4 hours from Richmond and had the tight-faced composure of a parent who had decided falling apart was not yet permitted. The night nurse was at Carter's side with the portable imaging unit. Dana stepped in. Carter looked at her. Hey, he said. His voice was careful, the voice of someone who had learned that certain movements cost more than others. Hey, she said. I need to check something. She placed her hands on his chest with the same careful attention she had used 3 hours ago. The attention that read through tissue to structure. The movement was there. Subtle, but there, and slightly more pronounced than it had been 2.5 hours ago. Imaging, she said. Merritt was already looking at the portable screen. The rib fractures were clear, 3 confirmed, a 4th possible, and in the lower left segment, the beginning of the instability that, in another few hours without intervention, would have become something that required significantly more than what this hospital could provide alone. We catch it now, Merritt said. We can manage it here. Another 2 hours. Roanoke, Dana said. He stays. We have the equipment. We have Westphal. Westphal is post-op with Ortega. Merritt looked at her. You know the stabilization protocol, he said. It was not a question. Yes. Then we work it together. She looked at Carter. He was watching them with the alert wariness of a 19-year-old who understood that the conversation happening over his chest was about him and was important. Am I okay? He said. Dana looked at him directly. You're going to be okay, she said. We caught something. We're going to handle it right now. He nodded. He looked at his mother. His mother looked at Dana with an expression that contained everything a parent's expression can contain when a stranger tells them their child is going to be okay, and they have to decide, in that moment, whether to believe it. She believed it. Dana saw it happen. The settling of a face when the decision is made. She turned back to the work. The next 40 minutes had no space for anything except the task. Merritt worked and Dana worked, and they moved around each other in the small room with the efficiency of 2 people who had arrived, through different routes, at the same understanding of what mattered. He did not ask her to explain. She did not ask for permission. Elaine appeared and received 2 simultaneous instructions and completed both. Farhan appeared at the doorway and Dana said over her shoulder, Chest binder, 48 centimeter, not the 50. And Farhan returned in under 90 seconds. Carter's vitals held, the segment stabilized. At 11:14 p.m., Merritt straightened and looked at the monitoring screen and said nothing for a moment, and then he said, Good. It was the same word he used for chart reviews and inventory approvals and everything else that met his standard. But in this room, at this hour, it carried a different weight. Carter's mother said, "Thank you," in a voice that had used up most of its steadiness. Dana looked at Carter. He was looking at her with the expression she had seen on young soldiers after an operation that had gone wrong and then right. The look of someone who has been on the edge of something and has come back and knows, in the clearest possible terms, what coming back means. "You knew," he said, "when you checked me the first time. You already knew." "I suspected," she said. "You flagged it." "Yes." He was quiet for a moment. "I've been in the Army 2 years," he said. "I know what it looks like when someone's been in longer." Dana said nothing. "Whatever you were," Carter said, "I'm glad you were here tonight." She looked at him for a moment. She was here. He was alive. Those two things were connected. "Get some sleep," she said. She walked out. In the corridor, Atlas was waiting. Elaine had positioned him outside the door during the intervention, not removed, just placed where he could see. He stood when Dana came out and came to her side and walked with her down the corridor, slightly forward and to the left, matching her pace exactly. She stopped at the window at the end of the corridor. The Blue Ridge was invisible now, just the dark shape of it against a sky that had gone deep blue, stars beginning to resolve above the hills. She had stood at windows like this in places that no longer existed on any map she could show anyone. She had stood at this window for 2 years. She placed her left hand on the glass and looked at her fingers and thought about what Carter had said. "Whatever you were, I'm glad you were here." She looked at Atlas. He looked back at her with the steady, uncomplicated regard of a dog who had run through a corridor and found what he was looking for, and did not require the situation to be more complicated than that. She reached down. He pressed his head into her palm, the way he had always done. The pressure of an animal communicating something that did not require words and did not benefit from them. Behind her, footsteps. Hail. She did not turn around. He stopped beside her at the window and looked at the dark hills and did not speak. They stood that way, the woman and the man and the dog, with the weight of the day settled around them like a change in atmospheric pressure. "Carter's stable," she said. "I heard." "Flail segment, early stage, we caught it." "You caught it," he said. She looked at Atlas. "We caught it," she said. Hale looked at her profile for a moment. Then at the window. "What did Merritt say?" he said. "He wants to restructure my role, formalize the trauma protocol responsibilities, create a clinical liaison position between the nursing staff and surgical team." "And?" She was quiet. The hills were dark. The stars were clear. Atlas's weight was steady against her leg. "I said yes," she said. Hale said nothing. She looked down at the dog. 2 years, 1 month, and 11 days of silence. Of small things, of staying below the line. She had come here to disappear. What she had found was that certain people do not disappear. They change location. They carry the same knowledge and the same hands and the same capacity for the work. And the work finds them. The only question is what they do when it does. She had answered that question today, 3 times, in 3 different rooms. The same answer every time. Atlas pressed his head harder against her leg. She looked at the window. The stars above the Blue Ridge were very clear. Ghost Actual was still here. She had just stopped pretending otherwise. The end. If this story moved you, hit that like button right now. Drop a comment telling me where you're listening from. I read every single one. If you're new here, subscribe and welcome to Secrets of Silent Badges. And share this with someone who needs to hear it today. We'll see you in the next one.